Hello, welcome back. And we're staying with health matters today. Our guest this time is Dr. Tuyi Mebawondu, public health consultant. Good morning to you, Dr. Mebawondu.
Good morning.
It's a delight, as always, to have you on. Now, what we're hearing of now is Omicron COVID-19 variant. We've heard so much noise on it. And so much anger is also in the air because there are those who are feeling that, wait a minute, apart from the whole matter of COVID-19 Omicron variant, there seems to be in the world, people shouldn't make it a South African variant or anything like that, and let them just find somebody else to make a scapegoat of. But I joke, and I'm sure you'll comment on that. What we've heard from the experts is that not very much is known in fact about the Omicron COVID-19 variant. Apparently, you scientists and doctors cannot really say categorically that it is more virulent than those that have gone before, or that it is more easily transmissible. So, what can you tell us, Doctor, about Omicron COVID-19 discovered in Botswana, I hear, reported to South Africa, the scientists of which now gave it to the world?
I think the first thing I want to say is this. Rightly so. We're tired. We're not happy about the challenges we're facing with COVID-19. We're fatigued. We don't even want to hear about it again. But the virus is not tired. As long as the virus is not tired, we shouldn't get tired. We have to come straight and confront anything that can revert us to the age of darkness. What I mean essentially is that we saw that smallpox killed more than 500 million people those days. We can't afford that now. So, right now, more than 260 million infections worldwide, 5.1 million deaths. Africa is having about 9 million. South Africa having 3 million out of that 9 million. In fact, 3 countries. You're
talking about COVID-19 generally now.
Generally. COVID-19.
Well, that is the Delta variant. Yes. That's what we're dealing with now.
We're talking about any numbers now. So, but what we've seen now is that this is not the first time we're seeing variants or mutations, because this virus uses human body to copy itself. In the process of the copying, mistakes happen. Sometimes those mistakes can be deleterious to the virus and actually reduce the potential of the virus. But sometimes it's advantageous to the virus. So generally, scientists are watching every variant that is coming out and try to monitor. They are what we call variants under monitoring. Those ones are quite a lot of variants under monitoring. Then there's a variant of interest. If you are monitoring and then it becomes variants of interest, if it shows some other, propensity, then there's variants of concern. There are variants of concern.
Which is what Omicron is.
Omicron is variant of, Alpha is a variant of concern, Beta is variant of concern, Delta is variant of concern, Omicron is variant of concern, and even Gamma is variant of concern. So there are many variants of concern.
Now, sorry, Doctor. This is reported to have been cited or noted first in Botswana. Botswana, so the story goes, reported this to South Africa. The scientists there, who have been praised, excellent scientists there,
yes, exactly.
They verified it and then did the next most responsible thing of notifying the world, WHO, even though South Africa is now complaining that, wait a minute, instead of being commended, why are we being, what is the word now, stigmatized? And
I think it's the, you see, let's face it, the world faced a lot of lockdown, economic recession, political upheaval because of COVID-19. Now, you cannot take away such remnant anger from so many people. But again, it's not anger in a way. But if somebody says that this thing is from South Africa, we knew that the Alpha came from UK. And we shouted at that time. We knew that the Beta came from South Africa initially. And the Delta came from India. Okay. So every time the thing originates from anywhere, we mention the place. It's not stigmatization. Wait, it's not stigmatization. And then when it comes to restriction of movement, at a point in time, Italy In fact, flight was banned from Italy, flight was banned from India, flight was banned from Brazil. Okay? It's not a new thing. It's just the emotion we put to it that, for me, I don't find reason for it. So, yes, we commend excellence, excellent science of South Africa for a very nice work done. Now, look at it. I'm not be part of the people that will say that this is originated from South Africa, because instantly you are seeing it in how many countries? We're seeing it in, as far as Japan, Hong Kong, Netherlands, UK itself. You're seeing it in Israel.
Do we know that know that we're seeing it in Nigeria at all?
Well, for me, we've not.
We've not.
The capacity, in a way, the capacity for Nigeria to do what we call genome surveillance is challenged.
Okay.
It's challenged. We don't have that capacity to do that deep genome surveillance.
But as you know, Doctor, Canada has announced that 2 cases that it has determined, that it has seen, are reported to have had travel history coming from Nigeria.
So, and don't forget.
What does that mean?
Don't forget, a few weeks ago, our president was in South Africa to attend some trade issue, trade agreement or whatever it is. And he had an entourage, okay? And he left that place and came to Nigeria, okay? And I've been mingling with people. So, in a way, if somebody says it's in Nigeria, you can't say no. You remember, when the Delta variant came up and Nigeria was still saying, it won't be here, and I told you that it's here already. Before we know it, it was confirmed that it's here. So, but the challenge
sorry to interrupt you. Well, I know one has to be very, 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 very careful about getting news off social media, but there have been some reports that in Botswana, the cases of this, Omicron variant was noted among what is it now? Diplomatic staff, the country of which has not been named, and that it should.
That is why I was saying that
people should be careful about how they
nobody should label South Africa as the origin of Omicron variant.
Exactly, but that's what is being done.
That's what I've just tabled here now.
Yes.
It's in Netherlands, it's in Hong Kong, it's in Japan, it's in Israel, it's in UK. So we're seeing the constellation, we're seeing the thing, spreading everywhere at the same time.
You probably know Dr. Lakija, and she's been saying that part of the problem that we're facing is that the world is not being fair to Africa. Your comment on that, by which she means that number one, I think you dealt with the whole stigmatization allegation, but there's also the matter of, look, make it possible for these African countries to make the vaccines themselves. You're smiling, so I don't know what you think of that suggestion. Do we have the capability, if the knowledge is shared with us?
Here, I emphasize the fact that if you want to fight this COVID-19, let us get vaccines at all costs. Anyhow, in fact, I itemize how we can scale up and start manufacturing one of the approved vaccines. But you see, we must separate emotion from facts, because in reality, when COVID broke, and then even as far back as December, when the thing came out from Wuhan, somebody, individual in India, was going around, the CEO of Serum Institute of India was going around picking glasses. They were laughing at him. He went around signing contract manufacturing agreements with AstraZeneca. They were laughing at him. Who did that in Nigeria? Who did that in Africa? And then now, by March, COVAX came up and said that, listen, we're housing these 92 million vaccines to you, Africans. African leaders kept quiet until 6 months after, in August, AU was now merging with Afrexim banks and other people to get vaccine, even though some are still promises. African has not taken their public health seriously. Let's get that straight. We've not taken our public health seriously. Now, why must you every time going cap in hand? We are being unfairly treated. We are being unfair. But if you have scientists, what is the difficulty thing? Even look at ordinary, what's it called, the COVID-19 card. That was supposed to be a simple straight thing.
Okay, that
we were
one.
forging it. How do you not trust MRA technology to people that can forge ordinary cards. It's a lot of issue. And then look at your infrastructure. Don't let us, you see, this is not an issue of emotion. Africa must stand up and compete appropriately. We have to graft thinking, we have to graft leadership, we have to graft innovation from everywhere. Why can't we honestly think and say that, listen, what are we really doing now? What's our own, in terms of research and development? It's not just by mouth, it's not by emotion. What are you doing exactly to be respected in those high-level, very technical, scientific endeavor?
In terms of public health, what is your assessment of the seriousness, or shall I say, the danger of infection? Because I said at the top, from what I've just read, studying the whole matter, that doctors don't really know, contrary to some accounts, whether this is much more virulent, whether this is more easily transmissible. So where are we now? And unfortunately, you know the situation with Nigerians. There are still a lot of people that are saying in this day and age that, number one, they don't believe in COVID-19. We've spoken about them copiously. And then, you look at the way we go about our lives, look at the shopping malls, it's thronging with people. People don't use the mask anymore. What's the level of our danger if we continue the way we are?
Now, you see, again, when you have a variant of concern, like this Omicron, what you do is that to look at the trajectory. Is it a milder infection? Is it a more serious infection?
Do we know that?
But as long
do we
as
know the answer to that question?
Yes, as long as you're trying to understand that question, you don't want it to spread.
Yes, yes.
You don't want it to spread.
Yes.
So, because if it's a very virulent form, okay, if it's a very virulent form, then if you allow it to spread, it will do more damage. Everybody's running away from lockdown. Let's look at Israel. Israel's strategy is simply this: we don't want to lock down. We don't want to close our economy. So, and they said that, listen, except you're an Israeli, you can't fly in.
You can't come in.
Even the Morocco zone is even worse. Morocco is telling both, if you are abroad, both, whether you are a Moroccan or foreigner, stay away for the next 14 days.
Don't come back home.
Don't come back
for now.
For the next 14 days. Because that's seriousness. That's seriousness. Because they don't, because Morocco is like number 2 in Africa. You know, South Africa is the ground zero. Morocco is number 2. Tunisia is number 3. So they said, don't come back home. So I don't know why anybody will be angry and be worried that, okay, why should we block flights? Why should we prevent flight from leaving South Africa? Because we have to curtail so that we can have a better understanding. Now, what are the factors that tend to enhance mutation? When you are not vaccinating, when you don't do sufficient vaccination and you allow the virus to move in community, as more as the virus copies itself, mistakes happen, variants develop. So for us in Africa, if you want to deal with the mutant strain really, because South Africa has just done about 20% of its population vaccination, okay? In the whole world, Africa is 10%.
And compare that with Nigeria?
Nigeria is where we're 3%. So now what it means essentially is that in an environment of Nigeria now, the likelihood of getting a mutant strain is higher because we're not vaccinating, we're not observing the protocol. The other time, government was talking about giving private hospitals 6,000 naira so that they can vaccinate, or paying 6,000 naira. But again, where are the vaccines? It's not just, and then why are we not, yes, vaccine is good, why are we not de-emphasizing other non-pharmaceutical preventions?
You know, with okay, I hear what you're saying.
Because we don't have the vaccines, and we just keep mingling around. If a mutant strain enter, because you see the mutant strain can be easily transmissible, can lead to more severe infection, okay, can actually affect younger generation. These are the critical issues we're looking at.
And in the West, they are spreading their net wider. Children as young as 5 are now being considered to possibly be vaccinated.
Nobody wants a lockup again. Nobody. I can assure you.
Yes.
Anything possible. Because, you know, if you look for some people that lost election, maybe this year or late last year, it was because of this kind of issue. You locked us down, the economy went on tailspin. Nobody wants lockup, and that's why you see that their decision is a kind of rash and very deep in terms of very, you know. So
now our level of vaccination coverage is abysmally low, as you've just stated.
Embarrassingly low.
Okay, so where does that put us in terms of danger? I mean, some of us are saying that, I've had both even before Omicron was announced, people who had both of their vaccinations were being told, not yet Uhuru, don't begin to rest easy.
You know
now we have this. So some people have maybe, I don't know if some people have just one of the doses and are, soon going to get the next one. But and there are those, in fact, there are many that don't even have any form of vaccination at all. But when you look at it against the backdrop of scientists are still saying that they don't know yet. We can't just be telling you stories. We're scientists.
That's being sincere. That's science for you.
Yes.
Science will be sincere and tell you exactly what they know.
We talk with evidence.
Now,
so we don't know really.
No, let me address the issue of having to actually do some other prevention despite double vaccination. Now, I will give 2 examples. Look at contraception, for instance.
Okay.
Contraception, even if you are taking contraception, does that mean that the person cannot get pregnant? It still fails.
It does.
Does that mean contraception doesn't work?
No, one can't say that.
Exactly. Now, if you look at the new malaria vaccine, 4 doses, 30% effective, just 30%. But we have kit instruments to deal with malaria. Net, sleep under net, indoor residual spraying, take appropriate treatment, and take vaccines. 4.
So you can bring all of that idea onto COVID as well.
Yes, exactly.
Which is not being done right now.
Take vaccine, use your face mask, avoid crowd, wash your hands. These are just instruments in your kit.
Keeping your socially distancing. Especially all of the things that you've just mentioned, Doctor. The worrying thing is that you observe all of those things in Nigeria today, I'm afraid, by their absence. You might be at a supermarket, you might be at a shopping mall, and there you are queuing up because you want a burger, and people are bumper to bumper. And worse still, should somebody now mention it, you get the bad eye and say, what's wrong with him? So our attitude,
it lies on the people who run such a center to impose those. They should. We shouldn't wait for government to come and start whipping everybody. If I'm running my center, please, COVID protocol, strictly COVID protocol, and I will ensure that, listen, part of the things we use to fight COVID is social distancing.
Yes.
Apart from the face mask, which is second thing,
and apart from washing hands,
hand washing, and avoiding crowd.
Yes.
Vaccine is also.
And here we are we're in a party season in Nigeria. As you know, here we are where the 12th month is just days away. All sorts of social engagements, weddings, and
burials.
Exactly. Well, even if burials, but at least weddings, traditionally in Nigeria, a lot of stuff comes in December, all sorts of Christmas parties. And as you said, no government wants to lock down. No government wants to annoy its citizens by saying that, sorry, we're going to interfere with your social affairs. In Nigeria, it seems to me that since government tried it, quote unquote, burnt their fingers, they've said, okay, just leave people. If those who know, let them do the right thing. Those ones that are arguing that there's no such thing as COVID, I'm afraid we can't do anything else for them. So we seem to find ourselves between a rock and a hard place in the country.
Governor is about taking difficult decisions, Ogayori. Governor is about taking difficult decisions. And then for me, if we can get the requisite number of the vaccine, I will target 2 key places: the transport parks and transport section, I'll target markets. Because I may even raise it to the point that if you don't show your COVID card, during interstate travel, I won't allow you to board my bus. So go and drive your vehicle.
So there are ways in which we can get serious
go and drive your vehicle.
We want to, if we have the will.
If you are going to be part of this market, where's your COVID card? Okay? If you don't have, then go and sell online. That's an option. Go and sell online.
But the problem, Dr. Tuyi, is, as you know, you're saying this, a lot of people can relate to what you're saying, but the vast majority of our people are not as enlightened. And so, for instance, somebody in business saying that he won't sell because you are not compliant in terms of having a mask, where's your card and all of that. Doctor, it's not going to happen in the Nigeria of today.
We don't want it to happen.
Okay.
Ogayori, many years ago, the world lost more than 500 million people to smallpox. It was a vaccine ordinance that compulsorily insisted that you must vaccinate that help us to eradicate smallpox. And people are taking that for granted now. You know, they're taking that for granted. You know, it was the vaccine ordinance that compulsorily, in fact, then, we had the traditional rulers, the religious leader, the imams, the afars, everybody. They were involved to ensure that the vaccine gets to everybody. In fact, at a point, smallpox were deified in Yoruba land, and they call it Shopono, and we're worshipping it. You can see what bad thinking can do to people. Or somebody said, no, go and take vaccine. And the vaccine was able to quell the thing, and we eradicate smallpox. So now, when its decision needs to be taken, take your decision. Okay. Because nature is not actually kind and is not bad. Well, what you reap.
Well, in the meantime, waiting for government to take those quote-unquote difficult decisions, as you said, the citizenry itself probably owes it to itself to, if necessary, change their habits individually. Let every one person, be tallied, and then aggregate will make up the nation. So if everybody can take it upon themselves to do all those things you said, mask, wash your hands, socially distance, it will, and it will help a lot. It will help a lot. And then not
without mentioning name, suddenly one of the big churches had one of their big gathering together. They were rushing here and there. But all these things are quiet in the media. They lost a lot of their pastors.
Now
a few weeks after. They lost a lot of them. We know. But the thing is quiet. So you cannot, and that is why if anybody wants to do any program, now they should go and do it online. Do it online. God will hear your prayer.
Well,
if it's a mosque, God will hear your prayer also.
I guess, what advice would you give? This is probably the first of a number of conversations we're going to be having on this. With the announcement of Omicron now, your advice would be go back to...
Simply this. This virus is mutating. We don't know the next mutant. Good enough, what we're still having now, we can manage it in a way. There are instruments in your hand to deal with the virus. One is hygiene, wash your hand. The second is use face masks, avoid crowd, keep social distance, and the last is vaccination.
Okay, and how about that bit that you doctors also tell us to do everything you can to boost your immune system?
To help? Yes, because you have to eat very well to boost your immune system. And you know what the food is. Try to eat very well. Try to eat very well. Hopefully, your immune system goes up. Avoid, if you have further sickness like malaria, also if you know you are actually at risk, you need to take extra measures. To be sincere now, if you're at risk, you're hypertensive, you're diabetic, you have HIV, every other thing that you have to actually take some more precautions in managing yourself. Don't worry. We all die, but let's hold on a bit. Okay?
Oh dear.
Yes, please.
Oh dear.
Yes.
Doctors don't normally say that, but thank you very much, Dr. Tuyi Mebawondu, public health consultant, talking about Omicron. As you heard the doctor say, just do everything that you can to, everything in short of the vaccine. While the vaccine is on its way, and even if you've got both doses, we are told that it doesn't mean you are perfectly safe. Dr. Mebawondu just said that birth control is not 100% foolproof. So thank you very much, Dr. Mebawondu, for coming on. So I guess I'll just remember my own catchphrase: do everything you can to, be safe. As Dr. Tuyi has said, wash your hands, socially distance, wear your masks, and there's one more. I'm missing one. I forgot what it is, but
avoid crowds.
Avoid crowds,
take vaccine.
Especially as we are in this season of partying. That's our program today. I'll see you tomorrow, God willing, with a fresh edition. I'm Yori Folaren. Bye-bye for now.